Assalamu alaikum warahmatullahi ta'ala wabarakatuh. My name is Dr. Abdullah Shehu. I'm a consultant neurologist in Coventry. I'm also chairman of the Coventry Muslim Forum. Alhamdulillah, Coventry Muslim Forum, in partnership with NHS in Coventry and Warwickshire, have agreed and worked towards educating the public about long COVID. It's for this reason this video has been recorded not only in English but other languages as well. As we are aware, COVID itself was something that we experienced the pandemic of, which ended end of last year. Unfortunately, the COVID infection still happens to some of us, albeit not as frequent as before, and hence there's no further lockdown. A significant number of people who have been affected by COVID have suffered other symptoms that went on to progress for much longer, few weeks, few months after the COVID infection itself. These are the symptoms that may be called long COVID. They can be debilitating, they can be disabling and ruin the quality of life of the person who suffers it. And for that reason, we need to educate the public so that appropriate healthcare support is given to those who are affected by it. The part of the NHS national campaign is to make sure that everybody is aware of it and those who have been affected have the right aptitude in order to go and seek help. Symptoms that we need to be aware of include something that might even mimic common cold symptoms associated with it. Some might experience fatigue, which can be extreme or variable. It can come in waves. There may be some people who experience a sense of breathlessness or memory disturbances or even difficulty with concentration. These can also be compounded by disturbed sleep at night or feeling anxious and depressed, like all symptoms that may be part of the syndrome. Feeling generally unwell can be caused by anything, including tiredness. Unfortunately, long COVID does that very well as well. So these symptoms, as I said, can last a very long time and be disabling to the person who suffers them. And if the person does not understand them, it's necessary to seek help so that the appropriate support can be given. I'm pleased to say that all general practitioners are equipped to recognize this, and they have had the training for this. And once you see them and they assess you, they may feel that it's necessary to refer you to the team of experts that have been trained to look after patients with long COVID. These may include physiotherapists, occupational therapists, psychologists, or even involve meditation or pain management and many other subspecialties in the NHS. Referrals to these specialists has to be through the GP. We can't just go ourselves and ask to be seen, because the GP needs to do the screening to make sure there is no other disease that needs to be excluded which can cause similar symptoms. In addition to this video, there is also website information, and there is a leaflet we have prepared that will be distributed to the community in many languages. So this will be applicable to those who do not even speak or read English properly. If you think you have long COVID or know someone who has long COVID symptoms, as I mentioned initially, it is necessary that you recommend them to seek medical advice through the GP, and if you're the one, to go to the GP and discuss them. Of course, the GP will listen to you, examine you, and decide whether the symptoms are purely from long COVID or other medical condition that he or she needs to treat separately. For more information about the condition, please read the leaflets we have provided, including sort of the useful website, and as I said, they're in different languages. Together, I hope, inshallah, we will be able to conquer this dreadful illness and overcome the difficulties families, friends, and colleagues are suffering from. So thank you very much for listening, and I look forward to making sure that you attend to your GP with the symptoms.